factors impact treatment decisions?
Well, there's so many. One of the key ones is fitness, and fitness is a term that myeloma doctors use and rely on tremendously. And fitness it more or less falls into a couple different categories. It's more complex than that, obviously, but generally speaking, it's too old or too frail, or young and vigorous. And I stress to my patients that vigorous or frail is not determined by chronological age. It's determined by your physiologic age. Mm-hmm. That's really critical. So determining what your patient's overall fitness is really important in myeloma. And then we have to assess the risk of myeloma. I think we'll talk about this a little bit later, because not all myeloma is the same. And we treat myelomas differently depending on risk, certainly. And then patient preference is a huge part, because there are so many ways to treat myeloma these days that we explore options with the patients. And sometimes patients have pretty strong opinions about, one type of treatment or the other, for example.
What testing should take place following a myeloma diagnosis?
Testing in myeloma is multifaceted, because myeloma can affect patients in so many different ways. For example, it involves radiology studies to look for bone disease, urine work to see if the kidneys are affected by myeloma, a lot of blood work. And then we also do a lot of testing to make sure that we understand the whole health of the patient, because that comes into play so much when we're making treatment decisions in myeloma.
What advice do you have for patients and caregivers related to working with their healthcare team in choosing a therapy?
Yeah, I think the big thing is to do some research on your own, but you really ask questions when you see your physician. I mean, ask questions about, for example, what are my treatment options? Are there clinical trials that might be available to me? What's on the cutting edge in myeloma? What are the standard therapies? What are the pros and cons? And a question I often counsel patients to ask when they're seeking other opinions, is if you had 100 people like me and you treated them this way, how many would do well and how many would not do so well, and prognosis and so forth. And so and the other thing I think that's really important sometimes is gauging how experienced your physician is in treating myeloma, because we actually have data that show that patients who are treated in myeloma centers actually fare a little better than those who are not. And involving a myeloma expert in your care doesn't necessarily mean that you have to get your care at that center. It just means you may want a myeloma expert on your team. And pretty much every doctor I know welcomes a myeloma person on their team because the field is so rapidly evolving. It's really hard to keep up with for a lot of people.